Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. This channel is dedicated to amplifying the voices of doctors, other healthcare professionals, and patients as they share their unique struggles, triumphs, and passions. My mission is to build connection and create advocacy for healthy doctors, driving positive change that benefits both doctors and patients. This is a space for everyone who cares about the future of healthcare. If you appreciate this content, please like and subscribe now. It really helps the episodes reach our target audience. And by way of introduction, Dr. Arun Garg is a clinical professor at the University of British Columbia, Department of Pathology, Faculty of Medicine. He has a global interest in building strong links between organizations, institutions, and individuals in Canada and India. And Dr. Shirish Sachdeva has a doctorate in physical therapy. He's worked at the clinical and managing director of a multi-specialty health center in New Delhi. He's been a corporate healthcare consultant to major companies in India, and he's held various clinical and managerial positions in the U.S. with an interest in clinical teaching as well. You're both powerhouses, and I'm so lucky that we found a time that you were both available to have this conversation. And today we'll be talking about how when I had a conversation with Arun, he spoke of his East meets West philosophy and how it informs his practice both in and outside the clinic. And I was fortunate to meet Shirish in person last summer at Dr. Jonathan Fisher's book launch party. And Shirish, like Arun, has been and continues to be involved in many interesting ventures, including Walk with the Doc, both in India and in the U.S. And my focus is to continue to offer hope for physicians and hope for healthcare. And I thought the two of you would have a very rich conversation sharing your perspectives and insights. And so here we are, and you're just meeting each other now, and this will be a lot of fun. So, Arun, what would you most like us to know about you as we begin our conversation?
Well, okay, I'm a physician of 55 years. My journey started many years ago, 1965, from India to Canada, from tropics to frozen lands, and it's been a great journey. And I think what I really want our listeners to know is that here is someone at 79 years of age, as passionate, as eager, and as enthusiastic about health, healing, and working with people. So thank you very much for having us, Kim. This is a wonderful opportunity, and the little meeting I had with you has just been inspirational. So I'm looking forward. I'm looking forward to talk to a colleague, Dr. Shirish, and here we go.
And thanks. I was inspired by you as well, which is why I invited you to be on. And I was inspired by Shirish when I met him last summer. So, Shirish, share a little about yourself.
Thank you, Kim, for inviting both of us, and it's great pleasure meeting Dr. Arun as well. And like Dr. Arun, my journey started in India, in New Delhi, and I consider myself like if let's say if PT had three kids, I would consider myself the middle child because I am from the generation where PT was kind of transitioning from the bachelor's to master's to doctorate. So I did all three. I just kind of ended in that phase. And I'm that connecting link between the two generations. I am super passionate about preventive care in physical therapy, lifestyle medicine as well. And yes, I am engaged with the Walk with the Doc program, which is phenomenal in terms of promoting healthcare prevention and bringing community together. So that's it. And in my free time, if I get time, I love ping pong. So kind of get back to it, keeping my skills sharp.
I love that. And I know that Arun has some things to share with us. Before he does, I'd like you to briefly tell him what you're involved with as far as the ultrasound and the work
Ah,
that you do with that.
yes. So I am on the education committee with the Point of Care Ultrasound Academy, and my role there is to promote diagnostic sonography with all professions, primarily physical therapy. And I have been practicing diagnostic sonography in musculoskeletal field since 2015, so nearly now 10 years and plus and ongoing. I love that inclusion in our fields because PTs are uh, quite into anatomy, and on day-to-day basis, we utilize biomechanics, and there is no better way to visualize that mechanical system right in your clinics and see where the fault lies. And to get to the accurate diagnosis, we can use that. And I also used to perform diagnostic image, electrodiagnostics as well, but I don't do that currently in this particular clinic. But I think the inclusion of these evaluative tools now that we have in physical therapy have really uplifted the profession and sharpened our skills to make it a lot more cost effective for the patients, as well as contributing to the medical fraternity in terms of saving valuable dollars and time to both the system as well as the patients.
Yeah, well, thank you for your work with that. And Arun, if you had anything to respond to what Shirish has said so far, and then you can go on and share what you'd like to.
Thank you very much. Yeah, I think it's wonderful that you brought two of us together in your own judgment, two very different solaces, two very different impressions, but we are for the same cause. And I think just as an introduction, let me share with our viewers that I was in practice for solid 50 years as a consultant. And my practice was on biochemical medicine. And biochemical medicine, people don't fully appreciate, is the sum of the whole body. Essentially, what it is how we convert biological energy to live a healthy life. That's what biochemistry is. Thousands of equations, thousands of cells, millions of cells, as a matter of fact, how they're coming together. So I think this has been a great journey to transform from that to now what I'm doing is really based on that integrative approach I had in biochemistry, how we apply to the modern systems. What are the problems? What are the issues? And how we make our society healthy. And I think healing and healthier processes are in total. So that's my passion now. And in preparing for today's conversation, I thought if it's okay with you, if I could just share what I think is the root cause of burnout, what is the issue, and what is the hope, and what is the solution? And by the way, on your website, you have some beautiful links. And I just want to say right at the front, I found the link by on your website, role of body, mind, and intellect, very helpful. And I think I will recommend that link to, and I'll find the exact link. It's Healing Healthcare by Heather Buesler. I think she is one of the author, and she is writing about healing. And to me, that was the most close to what my thinking is. So I just thought, because it's already there, just mention that for our viewers for further information. So here we go. What I think is the significant burnout, disappointment among providers. First of all, it's a global phenomenon. It's not limited to US, it's not limited to Canada, it's everywhere. Like most systems, individuals' issue is the problem is complex and solutions are even more complex. So there are no easy solutions. It'll be a journey where we find solutions. So there is no magic wand. And complex problem is complex, solutions are complex, but not complicated. They can be overcome. There is hope. My own experience, which is limited to Canada, those similarities are global. And working with Canada-India Network Society, he has allowed me to see problem in Canada, US, UK, and India. So what I share is a sum of that experience. The root cause of the burnout or dropout or not feeling together, in my opinion, is that the providers feel isolated. They feel distance in their relationships with their patients, relationship with their providers, policymakers, public, and politicians. because we have taken a healing process and converted into a system, but have not filled the gap. My Based on experience, personal development has influenced my heritage. So I think that's the other point for our viewers, that everybody is individual, and what we say is the sum of how we are made up. What is our influence? And heritage and culture and cultural lens plays a huge role. In some ways, as you pointed out in your introduction, east of the best of the east and west of the west. So my diagnosis of the root cause is physicians do not feel, and I repeat again, physicians do not feel they are part of the system. They do not feel valued. They feel isolated. And second one, which is even more critical and coming from a subspecialist, is the over-specialization in healthcare. Over-specialization has removed the key contact of physicians with patients as a person. So the healing part is missing. So, Kim, the solution is provide education and engagement. So physicians and patient relationship is based on integrative thinking. Integrative solutions, patient as a person, especially in chronic non-acute issues, health promotion, illness prevention, and I think Shirish and I can have a lot of fun with illness prevention and chronic disease management. So to conclude, self-realization, self-awareness, self-empowerment are the areas where we have to work with the physicians so they feel engaged. And if I could end by saying maybe taking selfie is the solution. So role of body, mind, and intellect in health. Disease interaction, wholeness, and a new definition of healing is what we need to seek permanent, sustainable solutions.
Well, thank you so much, Shirish. I'm going to let you respond.
That is quite apt and appropriate. And ironically, just like what Doc said, 2 days ago, a patient and I were talking, and he was not really happy with what was going on with his appointments, going from one physician to another. Because I was saying, well, you would need X amount of physical therapy, and this would be like, let's say, 2 to 3 times in the week, and you're going for next 4 to 6 weeks out. And he was like, I got so many appointments. I have I have to go to 3 or 4 different specialists, and my mother has 3 or 4 different specialists to go to. So in a week, we're basically going for to 10 to 15 different appointments. It is so hard to kind of bring our appointments into the picture as well. So we become another specialist for them. So that integrative approach where we used to have one physician who would pretty much handle 60 to 80% of the issues in a single clinic, and then if need be, the specialist or the super specialist would have to jump into the picture. That process has broken down, and we have really split it apart into pieces where it has become a burden on the system as well as the people to even keep up with that process of reaching onto their basic goals on a day-to-day life. We're not talking about, really intricate, hard to find oncology disorders. We are talking about day-to-day management of, hypothyroidism, blood pressure issues. Even those are being spread around so much at times that there are 2 to 3 physicians, clinicians managing those issues. It is definitely taking a toll on the system. And to add to some stats on this, I think the the difficulty level that people are facing today, especially that nowadays we have generations in let's say the age group 35 and above, these I would call them, somewhat kids to young adults, are also having difficulties in managing and keeping up with these systems. And there was stats that were pulled off from my recent reading that I was reading Jonathan Haidt's book on in the anxious generation, which he talks about adolescence and kids and childhood. I feel that there is a lot of connection between that and nowadays young adults, because these are the ones who are handling our system and going into workforce and feeling the burnout at the best. And the stats were like from 2010 and these comes from the American College of Health Association data. They pulled up that the increase in anxiety went up 134% from 2010 to 2018, and depression, which was taken as the MDD, rose up by 108%. So major depressive disorders increased by 108%. Now, the interesting part here was that it was not just that the younger kids, 18 to 25-year-olds, were the only ones. Yes, they took the crown. They got up to like 139% increase. That was pretty hefty. But even the millennials from 26 to 34 years of age showed 103% increase in the same anxiety and depression numbers. Plus the Gen X, I mean, 35 and 49 years age group, they also showed a 52% increase in anxiety and all these stressors. The only group that actually took a real nice plummet was the 50 and above, the baby boomers. So, Doc, I think your generation took it really nicely from that time, and we got a decrease of 8% on that.
Wow. Yeah, no, I think you're absolutely right. But Kim, it will be important to bring to our people what we are not talking about very acute care. The very acute care require sub-specialists and all that training. But the root cause is that that very subacute care has taken over the whole system at the expense of building what I call fifth space or the chronic care. So I think what we're really talking about is that we need both and thinking. So in the acute care, thinking has very reductive because you're talking about a retina specialist, but not only retina specialist, right eye retina specialist, and one layer specialist. And you need that to have the outcomes, and it's a must. So I want to re-emphasize that. And the burnout among physicians is that we have distanced the whole thing and thrown the baby with the bathwater. And that's what I'm bringing out is that we need to turn the clock back a little bit and have the acute care subspecialty, but also build a strong chronic management support system where this integrative approach, and there has to be a conductor. And that conductor for the best person with the training still is so-called that general practitioner or a family practitioner or primary caregiver as a conductor, not as a director, a conductor. So role is different. Role is multidisciplinary. We need all kinds of support system, but we're not doing anything in that space. And that's where the burnout is. And as physicians, there is a great opportunity for us to grab the agenda and start building capacity in that space so we can then have ownership back and bring everybody with us. So it's not the issue of just giving and taking. It's not a self-interest. It's not conflict of interest. It's thinking of the system because that's what society needs. Healthy society, but the roles are different. And it used to be 80% would be in this chronic space, 20% in acute care. Now 90% in acute space and 10% in this chronic space. So we need to balance that.
I appreciate everything you're saying, and we have to value primary care so much more than we do and let them know that they're valued and change it from more sick care to well care and preventative and all that. And for some of the things you guys are saying, I feel like I'm a poster child because I think, as you both know, I've had cancer a few times the last few years, and it's just one doctor sends you another doctor. And I know it's because like they're trying to do the best for you, but I've literally, if you count all the radiologists and anesthesiologists, because I've had 5 surgeries and just I've seen a endocrinologist, nephrologist, cardiologist, rheumatologist. Like I've literally seen over 40 doctors. Where sometimes I'm like back in the day of what's that, Downton Abbey, right? But I don't know, that might not always have turned out well either. So, but Shirish, I bet you have a lot to speak to this from your focus on like functional medicine and such.
So, to add to that point, Doc, we're also trying to create a platform where primary care physicians work hand in hand with so-called primary care physical therapists as well. So even in physical therapy, we're noting that we're having vestibular therapists, we're having orthopedic therapists, we're having neurological therapists. All of them are becoming board certified in specialties and subspecialties. I have those too, and but the fact that I feel is that getting all those subspecialties should not separate us from where we began, from where we started. We started learning each and every system, and each system works together. One of my professors said me during my bachelor's training, they said, when a patient walks inside your room, they are not just one body part or one chapter in your book. They are the book. So they are coming back to you with all the disorders. Multiple systems are not right, and they're coming to you with one problem, but do not look at them with just one problem because all of the systems might be affecting what you're going to try and do with them, and they might not work right even after a couple times of your sessions with them. So holistically, if you look at them, and that way, if you understand at least, you can help in better triaging, you can help in better connection with different providers and work and help them to work together. So this system in which where PTs are embedded in primary care, and that way we can, right at the point of care, help the physician colleagues to triage these people in a righteous manner, decreasing the burden on sending everybody out to, let's say, an orthopedic specialist and then for MRIs right away. We can do that right in-house in the same clinic. That's where we're working towards that as well. And in some places, the system has already taken effect. And people are liking that system because it brings down the dollar cost to both the
Yeah.
patient, insurance companies, and it saves time. We've noticed that if people go for, let's say, a regular back pain to the physician, and then from there they go to an X-ray getting, and then from an X-ray come to PT, then go to an ortho, and then get an MRI. But if we are trying to cut that cycle out, and it takes time, because one, you don't get those appointments right away. There's a long waiting period between each and every step. So we try to minimize those steps and then try and get that care. Many a times, seeing the patient right on the first day with us and the physician together, we can get rid of that symptom, that pain, in a very comfortable manner. And not all of them need to even go to the next step beyond that. They're all taken care of right there and then. But again, there is a space for every specialty. It's just how do we make it a lot more efficient for each and every one of us and save time? Because as you said, the burnout is real, and that burnout requires using our forces together to make it a lot more easier on each and every one of us.
Yeah, I fully agree. And I think there is a lot of misunderstanding in finding these solutions. So everything we have talked about is not a rocket science. It has been talked about. But Kim, problem is how to solve it. And that's what I said. It's a complex issue because providers have got in this space and they see a self-interest and the conflict of interest in solving the solutions. So that's where the policymakers and all that have to come. And we do need to turn the clock back. And this is where the wisdom of the best of the East and the best of the West will prevail. Because humanity, humans, Homo sapiens, have been around 12,000 years. We are going through some major changes. And I think the wisdom is think of the person as a whole and then find the solution which affects the person as a whole. And I think there is the need, and I don't even want to use the word like primary care and things like this, because each word has been possessed by, hijacked by providers. And the moment you use those words, everybody comes in and says, I own this, I own that. So what I'm saying is healthy society, and let's find a solution. What Shirish said, in terms of a integrative approach to the solution, and then use the subspecialties to subspecialties in directing the traffic.
Yeah.
Mm-hmm. And Shirish, I've seen physical therapists sometimes now employed in the emergency departments.
Yeah.
So that's fantastic. That's another thing, speaking to what you were talking about in primary care and in the emergency department. I think that's fantastic. It,
Fabulous. Yeah.
yeah, and I'll also tag you both. Earlier this week, I shared the episode that'll come up right before yours. I interviewed Dr. Afreen Sharif, who's an endocrinologist who specializes in cancer side effects, endocrine cancer side effects. And I had her on with Dr. Mary Lung, who's a hematology oncologist. And Dr. Afreen Sharif started a venture called Citrus Oncology, where within 24 to 48 hours, she has a panel of expert physicians who can and either do MD to MD consults. So if you're a hematology oncologist and your patient is having all these side effects, and again, it could be, nephrology, it could be a cardiac thing. And instead of just saying, I'm exhausted and tired, and they're like, oh, that's a cancer side effect. What if it's an endocrine issue? What if it's a, nephrology or cardiac issue? So she has these experts that can have MD to MD consults, but then also that the patients can have virtual visits with these doctors as well.
Yeah,
Yeah.
yeah. Go ahead, Doc, please.
No, 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 that's fine. You go ahead.
That is really, really important. Again, these virtual visits nowadays, especially after COVID, they have become a real bridge between a lot of providers as well as patients. And inter-provider communication has become easier as well. Systems, new companies have come up that have brought in a lot new ways that the effectiveness of this communication has gotten better. And it's only going, I think, further out from here with the involvement of AI that's coming up with use of different special tools that you can give to the patients as well. And you can monitor them with remote therapeutic monitoring, and that sends this information in a quick manner to your physician as well as to other providers. And that information is real objective information to make decisions on. So that process has become a lot nice. So I definitely see hope with that process going on.
Yeah, I totally agree. And I think to the end, because time is coming pretty soon, I think there is a hope. So, first of all, thank you, Kim, for taking the challenge of keeping our doctors healthy and the work you are doing. That is so wonderful. But I think there is a hope in innovation and transformation. Just finding the solutions based on the old equations not going to work. We need to respect our service specialist and we need to respect our sub-service specialization. But a new model has to be created where one shop, one drop, and everything is through that coordination. And there is the organization, there is the ownership of all providers in that. So the ownership has to be by the people who are doing the work. And idea is to minimize delays and understanding the person as a whole and then referring based on that.
Right.
Absolutely. And before I ask Shirish for some of his final words, how can our listeners get in touch with you, Arun?
Well, I think I'm available through social media. I'm on LinkedIn and Facebook and Twitter, and also our website www.cins.org, Canada India Network Society. And through you, if there was anybody who followed up, we'll be happy to connect through you.
Okay, absolutely. And Shirish, what would you like to say as we're winding down, and also how our listeners can get in touch with you?
Before I talk about that, one last point to add on to Dr. Arun's point, where when you mentioned about the solutions being complex, kind of reminded me of Stephen Bartlett's book, Diary of a CEO, where he talked about the ostrich effect. And he was basically referring to the nature of an ostrich, which kind of avoids danger by putting her head inside the
Mhm.
sand every time she sees it. So it's like we tend to
Mhm.
kind of ignore sometimes those difficult conversations by just avoiding them. And this concept's not new. I think when in India, people used to talk about pigeons looking away or closing their eyes when they see a cat. So kind of the same thing.
Right.
But I think the solutions that you provided are very relevant, and these conversations need to happen on a daily basis and on different platforms, so we can run this engine of momentum towards a solution for the betterment of the society. And thank you so much, Kim. I mean, the conversations that you create on a daily basis, on weekly basis that we see, they are very important, bringing all clinicians together and having these relevant ideas spread around at the rate that we need. This is where I think the power of internet comes into play. So, but I really like that zeal, that energy that you bring, and as far as connecting with me, LinkedIn is the easiest way, and as the doc said, connecting through you is brilliant. So anyone who would like to connect, that's one way. And for everybody else, I'd simply say, just living life in compassion is pretty neat. It helps our colleagues, it helps the community, it helps our patients, and that is one energy, that is one feeling that just benefits everybody.
Yeah, well, thank you so much. And Shirish, I had already met you by the time I spoke with Arun. And once I spoke with him, I just thought that the two of you would inspire each other. Because Arun has he's kind of more at the tail endish of his career, or maybe not, right? And just all the things that you've done and the way you're continued to be motivated and inspired. And Shirish is younger, and just all the things that he's done and the energy, enthusiasm that he brings, and that we're all working together. That's it's going to happen. We're all working together, and we'll make things better for everyone.
Absolutely.
Thank
Thank you,
you.
Kim. Thank you, Kim.
You're
Thank you.
welcome. Thanks again for being my guest. And in closing, to move the needle in healthcare, we all need to raise our voices, and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.